It's wonderful to be invited by Sanjay to speak to people who are already um, developing the real world evidence for bariatric surgery. Okay, so my disclosure today would be that you see those two textbooks of bariatric surgery edited by Sanjay. Me and my team, we helped copy edit those books. So it's been a long association with Sanjay. Now, coming to bariatric surgery, even though there is a lot of increase in the number of bariatric surgeries across the world, it still is considered one of the vastly underused treatments. We need more bariatric surgery research papers to increase the volume of evidence so that there is reduction in misinformation and stigma around bariatric surgery. Bariatric surgery is considered one of the fastest growing surgical fields, and there are new procedures every now and then there are new stapling strategies, new perioperative pathways being followed, and great metabolic outcomes. But we need to have more awareness around these, and to create that awareness, we need to have more papers published on the clinical benefits of bariatric surgery. We need these publications would help global collaborations and increase in innovations in techniques of bariatric surgery, and it will improve patient outcomes. When you publish your bariatric research paper, it empowers clinicians in other parts of the world and patients to plan their surgeries better. And meta-analysis of published paper, as we know, drives global policies. Now, there are papers being published, and many sleeve gastrectomy papers would mention the percentage of EWL or percentage of TWL, but there are some which will not mention what is more important to the patient or the treating physician. Let's say the GP, for example, not necessarily a consultant bariatric surgeon. Like, they miss out on mentioning the reduction in diabetic medications. They miss out on mentioning how the reflux was resolved or what benefits it did to the patient outcomes. Now, when you miss out on such important outcomes, your paper fades in the background even though the data was very strong. Another good example would be, many of you must be doing a lot of revisional surgeries, but there is definitely a dearth of information of revisional surgery across the world. We need you to publish more papers which stand out in the criteria that what is your patient selection criteria? What are your diagnostic workups before you do the revisional surgery? What techniques do you follow? Right? And what are the outcomes you get in your patients? Surgeons across the world are looking for such evidence to help plan their surgeries better. Now, all scientific research papers, as you know, is structured paper. And following the IMRAD structure does not just mean a regulatory formality or anything, or a formality for the paper. It helps you structure your story. In introduction, you're talking about why you ever did that study at all. What gaps were you trying to address? In the methods, you're talking about how you did address the gaps in literature. In results, you're talking about what your findings were without going into much of interpretation of the findings. In the discussion, you are talking about, so what? You found some results, but so what? How does it impact the clinical practice of the surgeon who's reading it? Right? Now, my suggestion would be to focus a lot on introduction and discussion to help your paper stand out. The numbers do matter. The numbers would be there in the results. Numbers do matter. But what makes your paper stand out is how you interpret the numbers and convey the meaning to the reader. And it's the meaning of the paper that gets it cited. There are certain standard guidelines that you could follow to shape your article better. You could go to the Equator Network, and depending on the type of study you are publishing, you could use a consort guideline for reporting a randomized study, the Strobe guideline for an observational study, Prisma guideline for a systematic review, or a CARE guideline for the case reports. Just remember the word Equator, and on Equator Network you would find hundreds of checklists to follow for any kind of article that you want to publish. Now, what makes your manuscript stand out? Here are a few pointers. A is for accuracy and authenticity. Make sure you have a strong methodology, valid data, and honest reporting. Brevity and balance. Keep your manuscript concise, but while you highlight the strengths of the study, don't forget to talk about the limitations or any complications you found in your procedure. C, clarity and coherence. Use a logical flow in the structure of how you write your article. Give very clear arguments in your manuscript. D is for distinction and depth. Say why your study is distinct from the other studies already published. What is novel about your study? And provide an in-depth analysis of your results. E is for engagement and emphasis. Start engaging your reader. Have an impactful title and an abstract so that the reader goes on to read the full manuscript. Right? Sometimes what happens is we just read the title and the abstract and don't go on to read the full manuscript. You want the reader to read the full manuscript. You could use a few visual to help them get into the manuscript, right? And emphasis on your key message for the manuscript. F is for fit to journal and finish. So make sure whichever journal you're targeting, you do follow the journal's guidelines. And remember to polish your language before you submit the article for review. Now, you could do with some professional medical writing support. That's what I provide. So professional medical writing support ensures clarity and compliance with international reporting standards. It increases efficiency by reducing the revision timelines, right? And it also increases acceptance of manuscripts because the manuscripts are set to the standards of the journal. Now, you could also increase the visibility of your article by including some other practices like using publication extenders. You could publish your article open access. Now, open access, you could publish it in some journals which are purely open access, or you could publish it in hybrid journals, but pay for your article to be open access, and so that the reader doesn't have to pay to read your article. Another good way is to have your article put up on a preprint server. These articles are not peer-reviewed yet, but your peers might read that article and comment or leave a comment which could help you improve upon your article. Many journals do allow you to post your article on a preprint server before submitting, but there are journals which do not allow you to post your article on a preprint server. So please make sure you follow the journal's guidelines when you plan to put up your article on a preprint server. Then once your article is published, you might want to create author videos on your article. You might want to include graphical and visual abstracts or video abstracts. Since many of you are surgeons, you might want to add a abstract of the video of your surgery videos in your manuscripts. Once the article is published, as authors, you could talk about it on podcasts and promote your article. You could announce about its publication on X or Twitter. You could also write a short summary of the article on LinkedIn and then provide a link to the article so that people go ahead and read your paper. Another great platform is ResearchGate, where you yourself can initiate a discussion around the topic and allow readers or peers to ask you for the full text of the article if it is not freely available over the net. Now, to wrap up, remember to keep your manuscripts accurate, balanced, and compliant. Accuracy is non-negotiable. Please make sure the numbers are correct. Like if you have mentioned in a table that there was a BMI reduction from say 48 to 28, make sure in the abstract the numbers are the same. In the main text the numbers are the same. So when there is no alignment between the numbers, reviewers get pissed off and they do not really give a good scoring for that article. Balanced, while you talk about highlighting your findings, remember to always mention the limits or the complications. When you mention your limits yourself, the reviewers tend to believe you are honest about your findings. When you don't mention your limits, they think you're just talking about the greatness of your study and without talking about what was the limit. Be compliant, use checklists that I mentioned, do include your ethical statements, and it's a good practice to include an acknowledgement even for the smallest help that you get, tiniest help from the statistician maybe, from a funding agency. So all your acknowledgements should mention the help that you've received. That's all from my side, and I'm available today for any engagements. My brochures are also outside with the book, so you can ask me questions if you have any.